Welcome to this lecture on 5D heart acquisition prerequisites and technique. In this session, we will cover the essential steps and conditions required to obtain optimal STIC volume using the 5D heart technology. Successful fetal cardiac imaging depends heavily on precise acquisition. The quality of volume data directly impacts the accuracy of subsequent analysis and diagnosis. Today we will focus on mastering the fundamentals from positioning the fetus and transducer adjustments to minimizing artifacts and ensuring complete anatomical coverage. By the end of this lecture, you will have a clear understanding of the best practices to acquire high quality cardiac volumes, setting you up for confident interpretation and clinical decision making. Let's dive in. Let's walk through the step-by-step process to get started with 5D heart acquisition. Step 1, we access the 5D heart mode by selecting the 5D heart tab on the touch screen from the 3D standby screen. Then we configure our image settings by choosing the appropriate rendering preset based on the gestational age, whether you're imaging in the first, second or third trimester. We adjust any additional image parameters as necessary to optimize volume acquisition. Next, we specify the target area for volume acquisition, typically focusing on the fetal thorax. Use the on-screen guide on the left panel to fine-tune the probe's positioning and orientation to ensure accurate alignment. Once everything is positioned correctly, press the freeze or set button on the control panel to begin volume capture. The system will automatically acquire 3D volume. After acquisition, the system will display the STIC loop along with the calculated cardiac cycle. At this point, the interface will seamlessly transition to the 5D heart analysis screen, ready for intelligent reconstruction of cardiac views. Following these steps ensures a smooth and standardized acquisition workflow, setting the foundation for precise fetal cardiac evaluation. In this live demonstration, we showcase the ideal technique for acquiring a 3D or 4D volume tailored for 5D heart analysis. The scan plane is carefully selected, starting from the confluence of the ductal and aortic arches superiorly, extending down to the fetal stomach inferiorly. This ensures comprehensive coverage of the fetal thorax. Positioning is crucial. Here the fetus is optimally positioned with the spine at the 6 o'clock position. This orientation minimizes shadowing and provides obstructed access to the heart. Image quality is paramount, of course. Notice the absence of motion artifacts, a stable fetal heart rate throughout the acquisition, and clear visualization of the cardiac anatomy during the entire STIC loop. The key takeaway is precise probe alignment combined with optimal fetal positioning is essential. High quality acquisition directly translates into accurate and reliable semi-automated reconstruction during our analysis. Let's begin with the most fundamental prerequisites for optimal STIC acquisition. image quality. Of course, a high quality volume starts with a high quality input. This means your 3D or 4D volume acquisition must be based on a well optimized 2D image. At a minimum, the image quality should be adequate, but ideally it should be superb. Any artifacts, noise, or poor contrast in the 2D image will compromise the entire stick loop and negatively affect reconstruction accuracy. Before initiating volume acquisition, it is crucial to fine-tune your settings, your 2D settings. This includes adjusting the focus, gain, contrast, and frame rate while ensuring real-time visualization of cardiac structures. Bottom line, even with perfect fetal positioning and advanced automation, subpar 2D image will limit the success of stick acquisition and subsequent analysis. Next, let's focus on optimizing fetal position to minimize acoustic shadowing and enhance image quality and clarity. Ideally, the spine should be positioned between 5 and 7 o'clock. This orientation helps reduce shadowing caused by ribs and the spine, improving visibility of critical cardiac structures. For cardiac access optimization, the pulmonary valve should be as perpendicular as possible to the ultrasound beam, and the pulmonary trunk should appear vertical within the image. To achieve this, adjust the transducer by rotating, tilting, or angling as necessary. Additionally, repositioning the mother or fetus may be required to improve the scanning window. Remember, even small adjustments in probe orientation or fetal and maternal positioning can have a significant impact on image quality and the success of stick acquisition. Minimizing acoustic shadows is essential for clear visualization of cardiac structures during stick acquisition. Make sure there are no significant shadows caused by the ribs, sternum, or limbs. Even partial obstruction can degrade the quality of key views, especially the 3-vessel and tracheal view. Your goal is to obtain an image where all the cardiac chambers and great vessels are free from shadowing, or at least are minimally affected. If shadows are detected, adjust the transducer angle or reposition the patient as needed to improve the acoustic window. Remember, a clear acoustic window is critical for accurate reconstruction of cardiac views and reliable diagnostic outcomes. To ensure comprehensive evaluation, the acquired STIC volume must fully cover the fetal thorax from the upper mediastinum down to the stomach. The upper mediastinum refers to a plane cranial to the 3-vessel view extending above the transverse aortic arch to include the neck vessels. This region is critical for assessing great vessel alignment. The inferior boundary must include the fetal stomach, ensuring complete coverage below the diaphragm. This is essential for accurate assessment of cardiac access and situs. In summary, a properly captured volume spans from above the aortic arch to below the diaphragm, enabling precise reconstruction of all key diagnostic views. Minimizing motion artifacts during acquisition is crucial for obtaining a clean and analyzable stick loop. Common sources of motion artifacts include the maternal movements, fetal breathing or gross fetal movements, and fetal turning or repositioning during acquisition. To reduce these artifacts, instruct the mother to remain still and avoid deep breaths. Confirm the fetus is calm and stable before beginning the scan. Perform the entire acquisition in one smooth, uninterrupted sequence. Remember, even supple movements can disrupt cardiac gating and compromise the quality of the reconstructed cardiac cycle. It is essential that the region of interest, or ROI, fully encompasses the entire circumference of the fetal chest during acquisition. This guarantees that all relevant structures are captured, ensures proper alignment in the reconstructed views, and prevents anatomical truncation at the edges. To achieve this, center the heart within the ROI box and avoid cropping too tightly to allow enough space for dynamic motion throughout the cardiac cycle. Remember, partial inclusion of the thorax comprises the integrity of the volume and risks missing critical structures. From the four-chamber view down to the stomach, it is crucial to maintain the fetal spine stable within the 4 to 8 o'clock range. Be mindful of spinal drift, where there is a gradual shift out of position during the sweep, and spinal rotation caused by fetal movement, which can misalign the cardiac axis. Consistent spine positioning ensures symmetrical cardiac orientation and accurate reconstruction of both transverse and long axis views. In short, spinal stability throughout the sweep translates directly to reliable cardiac geometry during post-processing. Azimuth errors occur when the acquisition plane is tilted, resulting in foreshortened atria or ventricle and distorted geometry in the four-chamber view. A visual clue to azimuth misalignment is if the heart appears asymmetrical or if the chambers look unusually short. To prevent this, ensure the probe is aligned to capture a true transverse plane. Double check the heart's orientation before starting acquisition, and avoid tilting the probe or scanning at an oblique angle. Remember, capturing true anatomical planes is essential for accurate representation of chamber length, shape, and symmetry. If all prerequisites are met, you're ready to capture the volume. Press the freeze button to acquire the optimized stick loop. Immediately store the volume to prevent any data loss. It's best practice to acquire an additional volume to confirm reproducibility or capture supple variations. It is suggested or recommended to have 3 volumes. Then proceed to the next step in the 5D heart workflow. Key tips: always double check the image quality, anatomy, the motion criteria before freezing. Capturing a high quality volume saves time and enhance our diagnostic confidence. All the challenges discussed during volume acquisition are inherent to volumetric ultrasound systems in general. These difficulties are not unique to 5D heart technology. Understanding and effectively managing these factors is crucial for successful volumetric cardiac assessment across any platform. Thank you for sticking with me through this essentials of optimal STIC acquisition. Mastering these prerequisites isn't just about getting better images. It's about unlocking the full power of volumetric cardiology and 5D heart to revolutionize fetal cardiac assessment. Remember, practice and patience turn good scans into great diagnostics. Keep refining your technique, stay curious, and embrace the future of fetal echocardiography. Up next, we will dive into overcoming the previously mentioned common challenges. Stay sharp, stay innovative, and let's push the boundaries of fetal medicine together. Thank you for your sincere attention and dedication.